economic, health outcomes, and the third one is social consequences. In one side, school closures affected like children development, right? In countries like Uganda, schools were closed almost for 2 years. So imagine the impact that this had in that generation of kids. But I would say that the consequences go beyond that. And just coming back to the health sector, what we are seeing consistently is like vaccine hesitance. It's increasing after COVID-19 vaccination. Right? COVID-19 was a big opportunity to accelerate progress. Vaccines were developed in a record time of 18 months. Right? It was incredible how we put scientists, private sector, governments, etc. together to develop one of a kind vaccines like mRNA technology vaccines. However, this acceleration, it got as well the side effect of this, right? The ripple effect was like a lot of people mistrusted this, right? Oh, you are doing these things so quickly, maybe you are not tested enough, maybe we don't have enough evidence.
And then the conspiracy theories.
Conspiracy theories, thank you very much. I know so many people that they people very well educated, but they don't believe, right, in COVID-19 vaccines, and now they're still to think about what other vaccines. So that's a major side effect. It's first time in the last 40 years that people are questioning vaccines. But we do know, we were talking about that before, that vaccines is one of the most powerful tools that we have to save lives. Since Pasteur invented them like 150 years ago, right, to avoid some diseases, right? Yeah. And still today we are questioning that. So COVID-19 had these major ripple effects and side effects all across the society. We still don't know what's going to happen, how we're going to evolve as a society. The risk of disease X it's real. It can happen anytime. I think we are better prepared than before. We have now, as you know, the countries are negotiating the new pandemic preparedness accord, the new agreement on pandemic preparedness. Now we have better tools than before. I was in 2014, I was in Sierra Leone responding to Ebola. At the time, we don't have almost any tool. I was there in Freetown when Ebola came to Lagos. And we were really scared, thinking what's going to happen in a city of more than 20 million people dealing with Ebola, right? And in the end, Nigeria did a fantastic job, was able to control it very quickly. But I think we're better prepared, but still, normally preparing needs investments, and it needs mindset, it needs leadership. And this is in many countries, this is missing. In Nigeria, we have a strong leadership. We're working with partners to ensure we have the resources that we need. So we hope that we'll be prepared for next time.
All right, so to just wrap things up, looking at all these programs, all the things you're putting in place and everything, how has it been, working hand in hand with the government of Nigeria?
Look, I used to say to my colleagues and friends in the global health space, right? So I have been working in many countries, and I am telling them, look, there is no better place in the world at this moment to work than in Nigeria.
Wow.
Global health. That's my opening line when someone asks me about Nigeria. Why is that? For two main reasons. The first reason is because of the impact that you can have in Nigeria, right? We saw how the health outcomes are still poor, so there's a lot of progress that can be made. And so the first one is because here you can see how things can move. And normally, if Nigeria succeeds, Africa succeeds, right? So if we want something to have impact at a scale, Nigeria is the right place to do it. And the second one, because of the strong leadership. The Coordinating Minister of Health and Social Welfare, Professor Mohamed Ali Pateh, is one of the best and the brightest minds in global health of his generation, right? So he was appointed, as you know, CEO of Gavi, the Global Alliance. He's a professor in Harvard, a former director of health and population at the World Bank. So the leadership that he's bringing to the sector and how we as partners were supporting that is really fascinating. It's really incredible. So I recommend people to come to Nigeria to work in public health. It's the right place to be. It's the right moment. It's a now or never moment, I would say.
Wow.
So that's why here we are.
Here we are.
All right, here we are, and it's. I think we could squeeze in one more question before you leave.
Before we let him go.
Let's go for like another 5 minutes first and foremost, something happened. COVID put a strain on public healthcare delivery across the world, and we noticed that even at the peak of COVID, countries in Europe and America were beginning to look for healthcare workers from around the world, and the UK actually specifically came to Nigeria to recruit healthcare workers even at the peak of COVID when there were travel restrictions, and that seems to have sparked a global scramble for more healthcare workers, especially in the West, in Europe. And a lot of Nigerian healthcare workers, doctors, nurses, etc., are now, let me use the Nigerian word, I know you know it, they are now doing japa to these countries. And more Nigerians are traveling to those countries to even study nursing, healthcare, whatever, to work in those countries. What do you think is the impact of this japa on the Nigerian healthcare space?
It's a huge impact. It's massive, and especially for those most vulnerable. We said before, I mean, it's difficult to find doctors, nurses, midwives in the most remote areas, in the most rural areas, right? Even the doctors that they decide to stay, normally they do in urban areas, right? And in the big cities, in Abuja, in Ibadan, in Kano, in Lagos. But it's difficult to really get doctors, nurses, midwives in rural areas of any state. So the impact is quite massive, and it's one of the main factors, because we have like a weak health system and weak primary healthcare system. So we have good news on some hopes. One is that the African Union has appointed the president of Nigeria, Bola Ahmed Tinubu, as the African Union champion for human resources for health. So we hope that being a champion for that will result in specific measures, right, to really try to attract and retain the Nigerian doctors are amazing, right? So they have like a massive presence in global stage. The reputation is excellent, right? Chikwe has been appointed as the director of the Berlin Center of WHO with the category of Assistant Secretary General, right? So Nigerian doctors are extremely good reputation, right? But how we can ensure that they are here in Nigeria and serving those most vulnerable? On top of the appointment of the president, we hope that the Nigerian health sector renewal investment plan will as well help into that. We are talking that we want almost 17,000 functioning primary healthcare facilities. And when we talk about that, we mean about having building a place to accommodate the staff, right? So that they have conditions that they really attract them to be, right? Nobody wants to be. I was watching some pictures of a health facility in Kebbi, where the health worker was sleeping in a very small room with the chickens inside. So really, the life conditions were not good. Who wants to live in that conditions, right? So we need to ensure that the conditions for our health workers, especially primary health care level, especially in remote communities, are good, are attractive, right? You have water, you have solar, you have 24/7 power. So I hope with this sector-wide approach and the Nigerian health sector renewal investment plan, we can really put these conditions in the table so we can retain some of these health workers. I am hopeful. I think health outcomes can improve in the next few years. I think it's a matter of urgency. I think it's a now or never moment. So that's why we're here.
All right. Thank you so much. We've been talking to Eduardo Celades. He is the Chief of Health and HIV/AIDS at the United Nations Children's Fund, UNICEF, here in Nigeria. Eduardo, it's a pleasure having you on the morning show this morning, and we do hope to draw you in. HIV/AIDS is a very important topic. Yes. I didn't want us to bring it in. It has to be a standalone topic of itself, and I know if we invite you to come back, you definitely would.
I definitely will. Thank you very much, guys, for hosting me today.
All right,
it was a real pleasure.
Thank you so much. Mario?
Thank you for coming, Dr. Eduardo Celades.
All right, and that's how we wrap it up on the morning show, the breakfast show, the People's Breakfast. It's been me and Miriam. We've been doing this since 6 a.m. and we've had a slew of guests coming in right up till the last one, Eduardo Celades from the UNICEF. And tomorrow we'll be back and we'll be talking about another topical issue by 9 to 10, plus all the other ingredients that make the People Breakfast your very best bet on the morning. Miriam, you sign off and we get out of the
Alright.
studio because Abigail is
Yes,
here
yes.
from 10 a.m. She's
Yes.
going to wind things up a notch more on the
Yes,
airwaves.
Absolutely. Don't forget that at 10 o'clock, the news update will be coming your way.
Yeah.
My name is Mira Mohammed, and he is.
And my name is Maddox Madukar Jumad. Have an excellent morning and keep it locked for 105.5. It is the People's FM.